friends, I'm on my way to my pre-op appointment for my mammogram. Today's appointment is to give me all the instructions that I need to know prior to going into surgery. I can't front, I'm a little nervous. Today is probably the first day that I've been anxious, nervous, afraid about something because I've had so much time to think about it. Everything else that happened before, it pretty much was like, this is what's happening, now we gotta go and do it. So this is the first procedure that I've had since my diagnosis that I've had a really long time to think, prepare, and get ready for it. It's a lot unexpected. I have tons of questions, but hopefully we can get our questions answered today. So I just had my physical exam from my surgeon, and we're very pleased. We can't feel any of the tumor in the breast tissue anymore. We can only feel the tumor that was in the lymph node. So now we're about to have our discussion portion where he's going to tell me everything I need to expect. I love my surgeon. Hi friends, this is my amazing surgeon, Dr. Garcha, and we're going to discuss our pre-op appointment for my mastectomy. Okay, I have a whole ton of questions, but I feel like I should just let you talk because you'll probably answer a lot.
All right, you want to start? Or you want me to start?
You can start.
Okay, so number one, you said mastectomy. We doing both?
Yes.
Okay. So I'll talk, I know we just talked about sparing the nipples, but so the plan's going to be to leave all your skin and all the nipple tissue and take out the breast tissue from underneath.
Okay.
Okay? And then Dr. Ashraf will come in and replace what we took out with an implant. Did you talk about that already?
Yes.
Okay. And is she going to do a nipple, I mean, is she going to do an expander, tissue expander?
Expander first, yeah.
Okay. So, which makes sense because that's sort of a temporary implant, and she can change the size by putting saline in it to get you to the right size, and then when it's the right size, she'll exchange it for the permanent implant. Okay. Also, at the time of surgery, we need to take some lymph nodes out from underneath your armpit. Okay. We already biopsied one of them, okay, that had cancer in it, so we definitely want to take that one out. Plus, we want to take some extra. All right. So, to make sure we get the correct lymph node, like the important one, which is called the sentinel lymph node, we're going to inject some dye in your breast on the day of surgery, or maybe the day before, and that's called a sentinel node procedure, where they inject the dye, and that dye goes to the lymph node where cancer would go to first.
Okay.
All right. So we want to make sure that's the most important lymph node we take out. So I'll be able to detect which lymph node that is during your surgery by using a little probe, like a little Geiger counter. So we'll take that one out, plus the one that had cancer in it before, plus a few extra. I don't know exactly how many that'll be. It'll be somewhere around 10, usually, give or take. We want to take out enough to where we get all the cancer out, but we don't want to take out so many that it affects the fluid in your arm or that kind of thing. And on the other side, we won't take any lymph nodes out at all.
Okay.
All right. The purpose of removing the other breast is a prevention for the future. It's not part of the treatment for this breast cancer. So we'll just do the breast tissue and leave the lymph nodes alone. All right. My part should take about an hour and a half or so, give or take. And then while you're still asleep, Dr. Ashraf will come in and do her part. It usually takes about another hour and a half to 2 hours. All right. So we'll plan on keeping you in the hospital at least overnight. We'll decide, we'll see how you feel the next morning. And if you feel great, then we'll send you home. Most people do. If not, we can keep you one more day. Okay. For your post-op period, you'll be seeing Dr. Ashraf mostly because you'll have some drains in, you'll have the incisions, she'll be doing the expansion of the implants. I'll be in touch with you as far as the pathology report stuff goes. Even though the pathology report isn't that important now. Okay. You've already had your chemotherapy and your treatment. But you may need radiation therapy afterwards as well, so we'll talk about that also.
How much area is breast tissue? Because I know you can even find lumps even like up in this area, so what is considered breast tissue?
All right, so it depends a little bit, but what we do is usually the bottom of the breast, you can see everybody's got a little bit of a crease there. Okay, the top is hard to say. Sometimes when you feel lumps up there, it's just lumpy tissue. It's not necessarily breast tissue, but it goes almost to the collarbone. Okay, so what's called the inframammary crease down here, the collarbone up there, and on the inside part is just sort of the side of your breastbone. Okay, the part over here is about what's called the mid-axillary line, which is about right if you cut your body in half, it's right about there. So, and we try really hard not to go past that. You know, we want to get all the breast tissue out, but we don't want to take out more than is necessary.
Will you take my cord out on that day?
Yes.
Oh, okay.
Because you're done with it, right?
Yes.
Okay. Yeah.
Okay, good. Let me see. So benefits of having, I can't remember which doctor I spoke, Mackay. When I visited him, he was talking about an incision underneath the breast, but then Dr. Ashraf was talking about an incision on the side. So is there a benefit?
So the pros and cons are, if we do it on the side like that, we can make incisions smaller. Okay. In order to, if we make an incision underneath, we got a long way to go. Okay, for me to be able to get all the breast tissue out from above. So you got to make that incision really wide.
Okay.
You know. So there's pros and cons to both. I'm comfortable with either. I usually leave that up to the plastic surgeon. My personal opinion is I think people do better with the side incision. Women don't like the idea of it because it shows more, but really it'll end up being smaller, and we can be really confident that we get all the breast tissue out that way. So.
When will I know? So I won't know about radiation until the pathology.
Right.
Okay.
But I think you probably are going to get radiation.
Okay.
I think it's a smart thing to do. I mean, like we talked about when we first diagnosed you, you're a young patient, you're otherwise healthy. You can tolerate all these treatments a lot better than our elderly patients. You've got a lot of years left in you. Now's the time to be a little more aggressive. You know, you've been through the worst part, you know, which is the chemo. You got to recover from the surgery. The radiation, although you got to go a lot, it has minimal side effects compared to when you just got to go a lot. So a lot of times by that point, a lot of women, they're kind of fed up and they don't want to do anything else. But in the grand scheme of things, it's really not that bad, and it's some good extra insurance. So we'll make the final decision, or give you the final recommendation afterwards. But right now, that's what I'm thinking.
Okay.
That's what I think you ought to do.
Recovery and kind of like what to expect in terms of pain and so how long of recovery typically? How long?
So it's not short, you know, but everybody's different.
Okay.
Most people tell me the first 2 weeks are the most difficult, as far as needing help getting up and moving around and not being able to drive a car and that kind of thing. Total recovery is probably 4 to 6 weeks.
Okay.
But once 2 weeks has gone by, usually the drains are out. Usually you're off any kind of painkillers. You have to drive yourself.
Okay.
So, but you're also younger, so you may be faster than that.
Okay. Let me see. I'm gonna ask you that last question last. How long before the pathology comes back?
So it usually takes about a week. All right. So when we do the surgery before chemo, the pathology is very important. The pathology gives us the stage, and the stage is how we decide what treatment to give you, whether you get chemo or not. We've already done that. Okay, so we gave you what's called a clinical stage a long time ago. The pathology really is not that important.
Okay.
You know, we just want to make sure it's all out, but your staging won't be accurate because the chemo has already worked, so the tumor's smaller. So I'll give you that about a week later, but just for you to know, there's nothing that's really hanging on that. It's really more of a formality.
Does this require like any kind of rehab?
So sometimes we give people some physical therapy. So I'll see you probably about 2 to 3 weeks after surgery. You'll have already seen Dr. Ashraf by that time. And let's see how your mobility is. A lot of women do feel like they can't raise their arms very high and they feel some tightening. So we send people to a physical therapist just to help them with some stretching and strengthening exercises. Not all women want to do that. Okay, sometimes women feel like they can do those exercises at home, but we'll give you a brochure about a place that matter of fact, I'll give that before you leave.
Okay.
Matter of fact, if you got time, it's not a bad place to go before surgery.
Okay.
Just so, because they're very helpful and they can educate you on what to be doing even before you go back to see them.
Okay, that's great. We are finished, so this is the last stop before surgery. I feel like I have all my questions answered. I feel very comfortable. Dr. Garch is very reassuring. I just met his PA, which is going to come visit me in the hospital the day after surgery. So we're good to go. We about to rock this thing.